Welcome to the latest edition of Public Health Updates, covering breakthroughs in the past 2 weeks, brought to you by Lucid Quest. A New Zealand trial has found that 2-in-1 inhalers can halve asthma attacks in children. The study, which followed 360 participants aged 5 to 15, compared a combination of budesonide and formoterol with the traditional salbutamol inhaler. The results were striking. Annual asthma attacks were cut by nearly 50%, around 18 fewer attacks per 100 children, with no reported impact on safety or growth. This could soon influence prescribing patterns and payer decisions once the full data are released. In the United States, new data reveal a worrying trend. Millennials are facing earlier onset of cancer compared with previous generations. Since the year 2000, cancer diagnoses among people aged 15 to 49 have risen by roughly 10%, with women disproportionately affected. Researchers point to factors such as processed food consumption, chronic stress, exposure to microplastics, and even prenatal influences. The findings may shape both prevention strategies and insurance discussions, though interpretations depend heavily on study design and control of confounding variables. Turning to cardiovascular health, a multinational study across the United States and South Korea has found that more than 99% of heart attacks, strokes, and heart failure cases involved at least one modifiable risk factor. Hypertension was the most prevalent contributor. These findings reinforce the critical need for preventive care and lifestyle interventions worldwide. Meanwhile, the World Health Organization has sounded the alarm on a global youth vaping epidemic. More than 100 million people now use e-cigarettes, including at least 15 million adolescents aged 13 to 15. With 62 countries lacking any e-cigarette policy, youth are 9 times more likely to vape than adults. This escalating trend could reshape regulatory priorities and market competition for nicotine products. In Uganda, a creative approach is saving lives. A trial involving 400 mothers tested permethrin-treated baby wraps alongside bed nets. The results showed a 65% reduction in malaria cases among infants with minimal side effects. Researchers say this strategy could scale easily, improving screening, prevention, and follow-up in high-risk areas. In the United Kingdom, a long-term cohort study of more than 123,000 adults over 10 years has linked both sugary and diet drinks to higher risks of metabolic dysfunction-associated steatotic liver disease. Just one sugary drink per day raised risk by 50%, while diet drinks raised it by 60%. The study's implications are still being debated, but it underscores the potential impact of beverage consumption on liver health. In a historic milestone for transplantation science, Chinese researchers have reported the first successful pig-to-human liver transplant with sustained survival. The genetically modified pig liver was transplanted into a 71-year-old man with liver failure who lived for 171 days post-surgery. This marks the first therapeutic success following previous experiments in brain-dead donors and signals expanding investment in xenotransplantation research. Finally, new genetic insights reveal that women carry a higher inherited risk of depression. A global study published in Nature Communications, analyzing more than 190,000 individuals, identified 16 female-linked genetic variants compared to 8 in males. While shared genes contribute to overall vulnerability, women appear to have stronger metabolic and hormonal links, offering new directions for personalized treatment. Stay ahead in public health research. Like, share, and subscribe for weekly updates. Visit lqventures.com or email us at info@lqventures.com for expert healthcare consulting. See you next time.